what denotes men's health in categories anywhere that you look. Category on some, I don't know, vitamin bottle, or in some news media, men's health. I don't know. Does that mean that we got to be healthy enough to still play football at the age of 80? I don't know. But I thought about it, and I'm going to tell you what I think men's health is all about. First, since men suffer cardiovascular disease at a far greater rate than women, although women are really catching up, then I think it's really about, one, preventing cardiovascular disease, and two, since men have a prostate and women don't, then it's all about prostatic health, because by the time you're 50, 45 to 50, you meaning if you're a man listening to this video, by the time a man is 40 or 50, he starts to experience BPH, benign prostatic hypertrophy. Benign means it's not cancerous related, and hypertrophy means it's getting enlarged. And you remember the commercials, or you probably still see the commercials on TV that say, you know, do you have this problem? Going. Well, that's what a BPH creates. It creates pressure on the bladder, and the enlargement of the prostate, since the urethra from the bladder through into the penis goes through the prostate. As the prostate swells, that swelling closes off or starts to constrict that canal. And so both the pressure of the prostate on the bladder and the pressure of the prostate on the urethra causes this problem that men experience, where they need to pee a lot, and every time they pee, they only pee a little bit. There was a great Jay Leno section where Billy Crystal was on Jay Leno, and Jay Leno says, gee, how does it feel to be, you know, now in your 50s? He goes, great, but I find myself peeing an SOS. Jay Leno goes, what the heck do you mean, peeing an SOS? And Billy Crystal says, well, you know, dash, 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 dot, 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 dash, dash, dash. So that's part of the symptom picture of benign prostatic hypertrophy. And there are natural products that can help reduce the risk of developing it. And when you do develop it, especially early on, there are natural products that can help shrink that prostate down. One of those that is very well known now, even some of the urologists in the Seattle area will prescribe it, that is saw palmetto. Saw palmetto is a type of a small palm, and the sterols, or the fatty acid components of that small palm, saw palmetto, are very effective in beginning to shrink and prevent BPH. And the way it does that is it prevents the conversion of testosterone to a particular type of testosterone that causes that swelling. It blocks that change. Another botanical product is Pygeum africanum, which is an herb that is from Africa. And it has similar sterolytic compounds that can affect the swelling of the prostate. Now, there is another third piece to talk about when we talk about men's health, and that is prostate cancer. There are a number of things that can be done to prevent prostate cancer. Nutritionally, particularly. One, lignans from flax seeds. Now, you can take those lignans in as flaxseed meal, or you can use high lignan flaxseed oil. I personally suggest not using the oil, but sticking with the flax seeds themselves. Ground flax seeds. Barleans and a number of companies specialize in organic ground flax seeds with high lignan content. These lignans have hormonal-like activity that help block the production of cancer cells within the prostate. There are other things. High intake of omega-3 fats or fish oils have shown also to be highly preventive for the development of prostate cancer. Some of the herbs we just talked about can affect it. Curcumin, that is the concentrated polyphenolic compound or flavonoid compound from turmeric, the herb turmeric. Curcumin has now shown in the peer-reviewed studies, some of those studies done at MD Anderson, the cancer hospital in Texas, that have demonstrated its anti-cancer capability in prostate cancer. Breast cancer is a number of other cancers, but prostate cancer as well. Green tea and some of the polyphenolic or flavonoid compounds from green tea have also been shown to have strong preventive activity in the development of prostate cancer. Also eating a diet high in colorful vegetables and fruits, particularly green leafies, and less meat, less grilled meats, more fish, especially wild-caught salmon and halibut and fish high in the omega-3 fats, have been shown to all reduce the risks of developing prostate cancer. So what is men's health? When you look at a topic that says men's health, I think it's really focusing on cardiovascular disease and preventing or treating the development of cardiovascular disease. Benign prostatic hypertrophy, either treating it or preventing the development of benign prostatic hypertrophy. And prostate cancer, either preventing or adjunctively treating prostate cancer once it's developed. Now, talking about prostate cancer, there's benign prostatic hypertrophy, there is one other piece. It's a prescription that I love to write. And even a couple of the urologists I work with will write this prescription. It's back to the old adage, if you don't use it, you lose it. Well, I have written a few prescriptions and gotten a few phone calls from wives here and there, both happy and both not so happy, to have more sexual relations, because the prostate is involved in lubricating and in lubrication during sexual intercourse. And that's a gland, and that gland needs to be used on a regular basis. So men having regular ejaculations, not too many. I'm not going to tell you how much too many is or how too little are, because it's all dependent on your age. But having regular ejaculations, regular sexual relations, is very important in keeping that gland functioning healthfully. So make sure your wives see this video. Be healthy.